It's dawn in Rwanda, on what promises to be a bright, clear June morning. Esperance Murekatete is preparing breakfast and getting ready to walk to the Child and Family Wellness Health Post in Rutunga and open it for her patients. 6 months ago, this clinic did not exist. Now it is just one example of a growing public-private partnership between One Family Health and the Rwandan government, increasing access to basic healthcare, education, and high-quality medicines.
It's a new concept. Bring the care near the population, give high importance to community care, prevention and treatment, knowing that we want to keep 80% of health problems at community level, and the PPP, that is something that is really encouraged to promote the private sector, but also to compensate what the public sector cannot do fast.
The health post model means people are seen close to home, gaining access to a type and quality of healthcare provision previously unavailable within rural communities. Here, the nurses and their staff reinforce the importance of basic hygiene, advising on lifestyle and family planning. Most diseases can be successfully treated or managed, including malaria, diarrhea, and respiratory infections. By addressing these challenges, health posts cover 70% of the diseases and conditions which account for 40% of deaths in the developing world. The model works through a simple franchising format. Qualified, clinically trained nurse franchisees like Esperance take out loans on favourable terms and benefit from ongoing medical, administrative and financial training. Then everyone gains from expanding success. Entry-level clinics are covered via the government-run health insurance fund, allowing the nurses to claim for a set number of services and products.
The key for me to One Family Health is the incentives that it can provide into the system, so that once the clinic reaches a certain threshold of patients, maybe 20 patients per day, the nurse, the franchisee, can actually start to break even.
In fact, most health posts are already seeing between 20 and 50 patients a day. For the poorest in the community, treatment is free. For others, it's covered by medical insurance and a contribution of about 40 US cents. Thanks to this new approach, Esperance and other pioneering nurses like her are able to run sustainable businesses whilst bringing essential, accessible, entry-level healthcare to their communities. This allows community health workers to refer people to the local health post, where basic and routine cases can be dealt with effectively. With only difficult cases being referred onwards to comprehensive clinics and then district and teaching hospitals, this reduces and balances the workload and provides a much better service to the local community. It's a great example of reallocating roles to improve efficiency and geographic access to care.
We have task shifting, giving nursing tasks to community health workers, doctor's tasks to nurses, specialist tasks to general practitioners, etc., just to provide more care and assuring quality.
One of the keys to the project's success is its reliance on simple, internet-connected phones, supported by sophisticated back-office technology. Using the internet in this way is about 30 times less expensive than adopting SMS technology, delivering amazing value for money.
The nurses are using only a simple phone to do the whole management of the health facilities. So from the registration of the patient, the drugs dispensing, and all the information regarding diseases, and even for the stock management.
Patient examination details are relayed from the receptionist to the nurse, who updates each record with a diagnosis and prescription. Because the phone is connected to a dedicated server, real-time information is recorded. Monitoring ensures standards are maintained, overprescription is prevented, and stock levels are maintained. The result is high-quality medical care. Capturing data in this way benefits patients, nurses, administrators, and One Family Health.
I can actually link up in my office in London and see when a patient in a remote part of Rwanda has actually been to the clinic and what they've been prescribed, which to me is kind of mind-blowing and I think very, very powerful and really positive aspect of the model.
Today, the Ministry of Health enters the data manually. Soon, the Ministry will launch an electronic medical record system, enabling data to stream into the system automatically. Yet, however it is captured, this vital information is allowing Rwanda to pinpoint pockets of disease, then target resources more accurately and cost-effectively. The first pioneering health posts have been a great success. The model works. It's transparent, so donors, investors and sponsors see exactly where their money goes and how it's used. It's transferable to any community and indeed nation. And most importantly, it can bring people with no other access to healthcare into the health system without having to walk tens of kilometres. Unsurprisingly, therefore, One Family Health and the Ministry of Health are looking to expand the franchise network. The Rwandan government's Vision 2020 programme envisages hundreds of health posts being opened across the country. One Family Health is currently contracted via a public-private partnership to develop 500 posts, serving 2 million people per year across Rwanda's rural communities. That's good for nurses like Esperance, for patients like these, and for nations like Rwanda. One Family Health. Essential medicines, accessible care.